Hi everyone, thank you so much for joining me. My name is Barua, and today I'll be presenting a meta-analysis that was conducted by my team and I, and it's titled Treating Psychological Symptoms After Brain Injury Using Cognitive Behavioral Therapy. The yearly incidence of traumatic brain injury, or TBI, is estimated at 50 million cases worldwide. This suggests that approximately half of the global population will have an episode of TBI at some point in their life. Individuals with a brain injury are highly susceptible to depression and anxiety post-injury, and this often leads to a decreased recovery rate. In fact, people with a brain injury can be 4 times more likely to suffer from mental health issues than the general population. And research suggests that the prevalence of depression after TBI is estimated to affect up to 50% of the patient population, while anxiety has been reported at rates as high as 70%. There are several ways for patients to manage these symptoms, and cognitive behavioral therapy, or CBT, offers an evidence-based, non-invasive therapeutic approach to address the cognitive and behavioral maintenance factors of various disorders, including depression and anxiety. However, its efficacy among those with brain injury lacks a unifying review. So the purpose of this meta-analysis is to address this gap by presenting a review focusing on the effects of CBT on depression and anxiety in patients who have suffered a brain injury. To accomplish our objective, a literature search was conducted to locate studies published from 1990 to May 2020 from several databases, including Medline, PsycInfo and EMBASE. Our 2 major keywords included brain injury and cognitive behavioral therapy, which resulted in over 850 articles that were screened by 2 independent reviewers, and studies were included if they met all our inclusion criteria, which were that the trials were randomized controlled trials involving CBT-based interventions targeting anxiety and or depression. Participants experienced a brain injury at least 3 months previous, and that these participants were at least of 18 years of age. And in the final meta-analysis, 13 RCTs were included, and these selected studies underwent risk of bias analysis using the Cochrane risk of bias tool to ensure quality. For our results, the pooled analysis suggested that the CBT interventions significantly reduced depression and anxiety immediately after implementing the interventions. However, the effect sizes were relatively small. And interestingly, the effect did increase at 3-month follow-up for depression. And this suggests that utilizing CBT for a longer period of time can lead to substantial changes in individuals' depressive symptoms. And unfortunately, similar analysis was not conducted with anxiety as we did not have enough sample size. Overall, this meta-analysis provides substantial evidence for the use of cognitive behavioral therapy interventions to manage post-brain injury anxiety and depression. However, given the small sample size, further research is needed to confirm trends found in this review. Additionally, we recommend future research to examine the long-term effects of CBT, along with how it affects in improving cognitive abilities within this patient population. Thank you for listening.